Here we are with Tracy, and she came into our clinic after going to lots of different doctors, even alternative doctors. She was suffering with dizziness, constipation, and diarrhea that was alternating, fatigue, of course, and hypothyroidism. A lot of women have hypothyroidism. Here's some of the reasons why we get a lot of results in our clinic. We come at it with a multifaceted approach. It's not just one thing. These are often complicated cases. A gastroenterologist or a doctor, maybe a medical doctor that takes a case on like this, the medical doctor had been taking care of her for 30 years with medication, which many times is a good thing to do. But for the first time in 30 years, she got her medication reduced by the doctor. They're like surprised by how her levels were doing better. So the reason why we got these results is because we're following the medical literature and the science of actually restoring the person to their ultimate perfect potential, all right?
Well, the dizziness, it makes it really hard to get out of bed in the morning or change positions because you're dizzy all the time. Constipation, diarrhea, you just don't want to be too far away from the bathroom. But I think one of the biggest things is I've had Hashimoto's for a very long time. And to be able to reduce my medications is a big deal. And I think part of that is the lasers have really made a difference.
Yeah, because you'd been to a functional medicine clinic. Actually, they do an amazing work and they help a lot of people. So that's supplementation, that's looking at blood work and stool tests to identify what is affecting these autoimmune reaction in the gut, right? So all these issues with the thyroid is here, but the epicenter of the problem is down in the gut. So what we did is we didn't just use supplements and what foods to avoid and what things to introduce as far as consuming here through the throat. We did that, didn't we? And some of those tools make a big difference. Like butyrate is one of the biggest things we can do to decrease inflammation in the gut. There's tons of good medical references we're going to include here. But you mentioned it, laser sets us apart. It's so surprising how few clinics will offer this, but laser, there's 10,000 studies on PubMed on how laser therapy, infrared and red light can be delivered into any tissue of the body, including the thyroid, to reduce the inflammation and heal the tissue. Literally, the tissue is going to be regenerated because of this. We'll post the studies. There's a 6-year longitudinal study where low-level laser therapy was used on people with hypothyroidism, what she had. And we looked at that study and it was like, hey, we could try this with you. It's worked for a lot of our patients. And we also not just laser to the thyroid, which will reduce the need for medication and improve the function of the thyroid, but the epicenter of why the thyroid is being attacked is from gut dysfunction. So you had this diarrhea and constipation. Medical doctors are throwing medications at this and maybe talking about magnesium, other things, which are always a good idea. But if that's not working, we've got to go elsewhere. So we lasered your gut. Can you tell us how you felt from just the laser?
The first time he used it, I noticed a difference in kind of like I felt lighter. So there was something working emotionally as well as other things.
Wow.
So the laser did do some good.
Isn't that cool? And we did vagus nerve stimulation, which is very well received in the medical literature for reducing inflammation and helping the gut-brain connection. So we were able to pay attention to the whole person's supplementation, looking at what foods to avoid. She's already really good, and you got to have a patient that's already open-minded, and she's already smart about her diet, knowing that certain foods like gluten is just going to trigger these reactions. So she's already was staying away from that, but her body didn't have a chance to heal, so we gave it a leg up. Can you tell us what this changed in your life?
I have a lot more energy. Yesterday I spent probably 8-10 hours out working in my yard, which I probably wouldn't have had a few months ago. So I think that's a good thing.
Okay, cool. And then we didn't really talk about upper cervical care, but that very particularly, she has a very distinct misalignment at the top of her neck, which caused a lot of stress and tension throughout her whole spine, which throws the body into a fight or flight sympathetic stress state, meaning the gut doesn't get the ability to have a gut-brain connection because the brain's too worried and being stuck and being tight, along with all the inflammation from her whole entire system. So the upper cervical care, we were able to come in and work on her neck, and that right away started making a lot of difference for her. Do you remember anything particular that helped you with? Any aches and pains throughout?
I think the dizziness was a big thing there with those adjustments.
Yeah, when she's out of alignment here, she'd have a lot of dizziness. So we would come in with this device. It's positioned at an XYZ coordinate system based on the x-rays, and her misalignment was such that we had a very particular way of realigning that bone very, very gently. Less than 2% of chiropractors are schooled in upper cervical sciences. And when we're able to properly analyze and evaluate and then image, and then after we get the proper imaging, we have to set up the patient and do very gentle work and not just cracking it. And that alone makes such a big difference for people that, in her case, because we identified there's a problem, we worked on it. Sometimes all we're doing is gut restoration protocol. Other patients, depending on what are these symptoms. All these symptoms can show up for various different causes, including other things that aren't even listed here. But this is what we identified were problems for her, so we addressed them, and her body functioned better, and all these symptoms went away.
So if they start coming back, I'll know where I need to go.
Yep. But it's been good. It's been consistently better. So we're really proud of her for being a strong person and being able to express her intelligence and her health better. I mean, this is a big difference, and I'm excited for you to enjoy this. Before we do the Atlas alignment, as with all of our patients, they have a pattern. When the top of the neck is misaligned, it changes the proprioceptive signaling into the brain, which are just muscles and how tight they are, how loose they are. The brain is always assessing information to know where the body is. So with my eyes closed, eyes are often, used as a reference tool so we can see where things are, so we can reference ourselves to our surroundings. Another sensory tool is the inner ear. So movement and spinning is integrated in that inner ear in the vestibular system. That's another type of information to give us an ability to understand where are we and where's our body in relationship to the world around us. What we're looking at here is the proprioceptive signaling. The brain knows without the eyes or the vestibular signaling in, our brain wants to know where everything is. So if I bend my finger, I can accurately move, say even my wrist to my nose, and I can do it smoothly. So that signaling, those little receptors are everywhere, but at the top of the neck, they're more densely populated here than anywhere else in the entire spine or in the entire body, okay? So when the brain is interested in knowing sensory information from the eyes or the vestibular system or the proprioceptive system, the brain's always interested in this area more than anywhere else. So if this is off, when the brain's taking in all this information of awareness to send up motor control for posture, for movement, if it's off here, the brain is getting incorrect information going in, or it's at least aberrant, meaning one side's more dominant than the other, and therefore when the brain sends that signaling, it'll cause a distortion pattern all the way down. So in her case, like with everyone's case, it has an upper cervical misalignment. Her spine, this paraspinal, meaning along the spine, these long muscles, there's lots of layers. These muscles in particular are for being upright and orienting yourself with your surroundings. When this is off, the brain tightens up one side, okay? So with her, we expect it on the left. And what do you feel there?
It's on the left.
What does it feel like?
It's a little tighter.
A little tighter, okay. So we're gonna look down here. You can come in and see up close here. This foot's a little bit shorter than that one, okay? So now we're just gonna have her sit up. We're gonna do the adjustment.
You want me to sit up?
Yep, go ahead, sit. So with Tracy here, we know exactly how we need to position her head and her neck and this table in order to get her spine neutral. And based on our very specific upper cervical x-rays, we took angles from above and down to look at the rotation of the atlas. We took different imaging to see the orientation of these bones. That's giving us the exact parameters of how to deliver this adjustment to her, so there's no cracking or twisting or popping with this. So with hers, we have to come in, approach it from behind, and we're going to go posterior to anterior at slightly this angle. We're going to make sure everything's lined up. The angle that she's at, right at 6 degrees, so that changes this just a little bit. And right behind the ear is the atlas bone. We don't have to go slamming in there like we would wanting to adjust the other segments of the spine. When we're adjusting the atlas, there's still a little friction between the skull and the other bones, that the atlas doesn't require a lot of force. By putting her in the side lying position, we can get that. So, and just like that, okay, you can go ahead and slide down and lay on your back. So we've just changed the alignment of that top bone of the neck, the atlas. That is changing the configuration for how these muscles are lined up. And we're expecting to see a change because we do so with her.